Good morning, good day, and good afternoon. Welcome to this session on health in impact assessment. I think this is number 4. I trust you found the other ones interesting. So what we're going to do today is look at the ways in which health is considered in other forms of impact assessment. I'm going to provide a kind of introductory talk with some overarching views, looking at better methods and tools and emerging guidance on health and impact assessment. So I'll really look at the better methods and tools, and then I'll be very pleased to hand over to Thomas Fischer and then to Odile Mekel and Ringen Piper. And between them, they will look at guidance on health in strategic environmental assessment and health in environmental impact assessment. The focus of this talk will mainly be, it's influenced by the European Union directives on SEA and EIA. So the geographical focus will mainly be Europe, but we'll certainly look at examples from outside, and there will be a kind of wider global applicability of what we're looking at. So my name is Ben Cave. I am very pleased to be the current president of IAIA. I've worked in health and impact assessment for getting on for 2 decades now, if not 2 decades already. And my background is in public health and in social sciences. So what I'd like to take us through to start this talk off is to look at, basically to take a step back and look at how health has developed within impact assessment. So the structure is, the health of the people shall be the highest law. I'm sure all of you know that's a quotation from Cicero, and is currently much on our minds as we face this current pandemic. I'd then like to look at actually, what is impact assessment? What do we mean by that? We often charge headlong into talking about impact assessment and rarely stop to think about what it is. And then also what makes it good. Now, these are clearly both important things to be thinking about if we're going to be defining or writing guidance and be using that guidance to get better in our practice. We'll then look at how we can work health into impact assessment, and then the emerging guidance bit as well. I'll hand over to Thomas, Odile and Ringen. In normal times, we would be meeting up, we would be face to face, but we are clearly currently going through the grip of a global pandemic. The diagrams here on the left is the diagram from the World Health Organization, which they prepared in 2017. And it's their pandemic influenza risk management diagram. And you can see they are very, very clear in this, that this is not an activity for the health sector alone. They identify 9 sectors, so health, defense, law and order, finance, transport, etc., etc. So those are the outer circle. And there's a continual process of readiness, response and recovery. And we're clearly in the grip of the orange arrow at the moment. We're responding, and we need to start moving into recovery. What gets particularly interesting is then, if you look at each of these sectors identified on the outside, is that within the activity that's going on, there are clear roles for national governments, subnational, local governments, and community. So we can begin to see here where impact assessment might come in. The other 2 images are just more up to date. So we have the WHO Strategic Preparedness and Response Plan from February 2020, and then some aspects drawn out of this, which show, and these are focusing in very much on particular aspects of the recovery, and placing less emphasis at this particular moment on the intersectoral action. But intersectoral action and multidisciplinary activity is something which will come through time and again in the talk. So what is impact assessment? It is, well, actually, this slide doesn't even define impact assessment. Really, it tells you that it gives you various names for impact assessment. I think we're aware that impact assessment is an umbrella term for many, many different types of impact assessment, each with their own particular characteristics. So the top two there, strategic environmental assessment and environmental impact assessment, are what we will return to, or what I'll hand over to the speakers who are following me to talk about. We then have other forms as well. And the bullet third from the bottom there, health impact assessment, we're looking throughout this to see how this can be merged into the other ones. Okay, so now, what is impact assessment? This was a paper produced by IAIA way back in 2010, and I think it's fascinating. It pulls out that impact assessment has this dual nature. It's both a technical tool for analysing the consequences of planned interventions, be that policy, plan, programme or project, and providing information to stakeholders and decision makers. So this can either be on a planned intervention or on unplanned events such as natural disasters, war and conflicts. And obviously the technical aspects are things which are of great interest to many of us. The second aspect of the nature is the legal and institutional procedure, which is absolutely critical. So it's a legal and institutional procedure linked to the decision-making process of a planned intervention. So we're not just abstractly concerned with improving a design and passing comment on what might be being prepared through policy, plan or programme or project. This is actually part of the formal way in which society gives permission, kind of validates a procedure moving forward. So these two aspects are critical to impact assessment and provide an interesting tension with which, as practitioners, many of us are familiar. Again, another way of looking at it. So we can see that impact assessment is concerned with scientific observation and analysis as we improve the way in which evidence and scientific data is brought to the decision making. Principles of design, so it's kind of good practice from other specialities and other disciplines. We then get into the application of regulations and law, so that's the legal and institutional procedure, and also critically how we interpret local and contextual rights and understandings. So again, there's an implicit mention there of what people and what communities are due and are owed, and also what they understand. And through impact assessment, we need to bring all these together. And as you can see, this is pretty challenging, and this tends to be done principally, or it gets most attention when we're looking at a contentious or sensitive project. So all of these aspects are in the mix. So if we're thinking what is good, how do we make things better? One way to look at this is to consider what is quality in impact assessment. And through some IAIA conferences, we ran some sessions at IAIA conferences, and this over 3 years, this came out with this particular article here. Now, quality is a vague and kind of slippery term. It can be applied to different aspects of any given field of practice. So, for example, in the business literature, quality can be framed in terms of quality management, product quality, and business performance. How does this apply to impact assessment? We can also think that the quality of a given product or service is not fixed. It's a dynamic value, which is debated and agreed upon amongst all different parties. And it's well known that quality is hard won and easily lost, much like reputation. So I'll just run quickly through the 8 dimensions of quality, and then we'll begin to look at some of the other aspects of the presentation. So the quality dimensions in impact assessment are efficiency, so spend the least amount of time and resources possible without jeopardizing the substantive effectiveness of the process. And we'll hear both Thomas and Odile and Ringen talk about a proportionate assessment. So we're not going over the top in scoping in too many aspects. Optimacy, the best procedures. Conformance, again, legal compliance and adherence to terms of reference. We'll come back to that. And legitimacy. So consent from both the responsible authority and societal approval. So the people who are immediately affected by project activities. The next set of quality dimensions are equity. Again, this is critical to impact assessment and policy making in general, and also has particular resonance for health. Capacity maintenance. The next one's capacity maintenance, transformative capacity and quality management, tends to look more at the system within which impact assessment is carried out. These are also important for public health, where we tend to be a kind of newcomers to the discussion, and have to ensure that public health systems are up to dealing with impact assessment, and likewise the public health practitioners are aware of impact assessment, and vice versa, impact assessment being aware of public health. So we now turn our thoughts to health in impact assessment. Going some way back to 2001, that's not too far, considering we started off with a quotation from Cicero, but health impact assessment also began to get going in the 70s and the 80s. This was a paper produced in 2001 by Rainer Banken for the WHO Europe. And he said, you can see in the text in the middle column there, that we need legal frameworks. We need knowledge on ways in which public health institutions function in different countries and settings. We need public health actors to have power in making intersectoral decision making. And we need to make sure that policy makers and people taking decisions are aware of health. And thus the final thing is enabling or empowering non-health actors to produce public health knowledge. And they can't do this by themselves. They need input and support and continuing quality control by public health. The bit I missed out at the top there as well is that technical information on its own is not sufficient to influence decision making. So we need all the other aspects underneath that. It's not just a case of providing good science and stepping back. We need a much more holistic approach to that. And then I've just pulled out there some quotations on the right about the importance which Rainer Banken places on legal frameworks as being one of the strongest means for ensuring that health is part of policy making. And then a challenge. Health impact assessment has particular values. So quoted here as democracy, equity, sustainable development, and ethical use of evidence. And these need to be brought into a coherent HIA process and institutionalized as part of existing decision making. Again, we'll hear later on SEA and EIA how that can be done. This slide here really shows two studies. So one on the left from Merkel-Winkler and colleagues in 2013, and one on the right produced recently in January 2020 by Milan Thondu and her colleague Joyita Gupta. And again, both of these show different ways in which health and health impact assessment is codified in legislation and guidelines. And so again, I think these are useful to read and maybe to compare one with the other. Tondu and Gupta tend not to look at the international documents; they focus on country level. So I think there's an important part of the story which we need to bring in there as well. Okay, so I'm going to run through a few academic articles here who've stepped back and looked at some of the requirements for health and impact assessment. This is one coming from Mark Nieuwenhuizen and colleagues in Barcelona and elsewhere, and they provide a useful sort of look at how health can be brought in. And what's interesting about this, again, is that they're advocating for a quantitative approach. So you might think that's highly technical and highly complex and difficult to access, but they actually emphasize, they go back to that importance of wider societal acceptance. And they're clear to emphasize that we need the chain from the very start of initial planning through to the end of the process, so including evaluation as well. You need to bring in the interdependencies and uncertainties of the real world. But this must be done in dialogue with the public and with other stakeholders, so that there's a wider societal acceptance of what's being done. What I might try and do also here is just show. Oh, nope, that didn't work. So I'll go back again. But in the fourth line of this bullet point here, they're talking about initial planning decisions and scenarios. So again, we'll hear more about alternatives as we go forward. But Nieuwenhuizen and colleagues place a great importance on actually not just looking at a given project or a given policy, but looking at different alternatives. This is going a little bit broader, or going actually different sort of geographical regions, so looking very much at a review of current practice in sub-Saharan Africa. I've drawn out three fairly downbeat conclusions from this, but the authors of this contacted a whole range of projects trying to get information on health impact assessment, and they didn't have much joy in receiving completed reports. So they concluded that the lack of transparency is a big barrier at the moment, and make a plea for improved transparency of the completed reports and the process. They noted a narrow range of health aspects considered, and this is a long-standing criticism of health in environmental impact assessment, that social aspects are not considered. There's an undue focus on environmental factors. And they say there's a lack of primary data collection, which is of concern, especially in low middle income countries where there's less routine data available. What is interesting, if we look at the image on the right, are the number of the types of health determinants that are looked at. So that's the top half of the diagram, and then the number and type of health outcomes that are looked at below. And clearly, this is important, and we need to ensure that health looks at both determinants of health and health outcomes. Okay, this one here is from. We're back to Europe. This is a review looking particularly at Italy. And it's, as the title says, a consultation with experts on the barriers and facilitators to implementing HIA in Italy. So on the left, we have an interesting diagram here, which results from their review of literature, showing what some of the barriers are. Well, actually, both barriers and opportunities. The white circles are opportunities, the grey circles are barriers. Ranking top amongst opportunities are political will, existing legal framework, there we go again, and capacity and expertise. So there needs to be that there needs to be the teams there who can do the work. And actually a paper which I haven't cited in this review, but is Mirko Winkler et al. And is based on a review of current global practice of health impact assessment. So I can give the link for that when we circulate the materials for this talk. But Winkler et al. Find in their global survey that capacity is severely lacking. So again, that comes up top again. And the absence, I just draw your eye to number 5, because the absence of a guide or best practice is shown as a barrier. So again, the following 2 presentations after this, they're both on guides. And then on the right, here we have the general steps and recommendations to strengthen the implementation of HIA at country, sort of across a country. And these are what actually came out of the interviews that they conducted. So again, have a suitable framework to make sure, and I think that's the framework within which impact assessment is conducted. So if we think back to the qualities of impact, that's how we measure quality. That's about the framework. It's the system it's conducted within. Clear commitment. So again, political will, capacity coming up again, and then down at number 5 again. Provide technical guidance. So that's what we're looking at in the presentations to come. So to conclude, I've rattled through. We've seen the role of guidelines and legislation. We've seen how impact assessment has this dual nature, that it's both a technical tool and a legal and institutional procedure, and both halves need to work well. And the guidance needs to recognise that as it's written. We show different aspects of quality, some of which apply to the written report, some of which apply to the process within which impact assessment is set in motion, and some of which applies to the system within which it works. And I suppose a point linked to that is that impact assessment is one part of making policy, and it struggles when it has to change all of these things by itself. It has a role in creating societal change, but it can't do it by itself. We then looked at ways in which health is or isn't, but could be worked into impact assessment. And we need both a supportive political system and operational requirements for practitioners to put things in place. And then emerging guidance, as I've said, we're going to go on now to hear 2 examples one about SEA and one about EIA. So it remains there for me to say thank you very much. I hope you have found this talk interesting, and I'm sure you'll find the following talks interesting. So, who do we have coming up? We have Professor Thomas Fisher from the University of Liverpool and Northwest University, and Thomas will be talking about draft guidance on assessing health impacts in strategic environmental assessment. And he'll talk us through the development of some guidance which was done under the auspices of the UNECE, and with input from the World Health Organization and the European Investment Bank. We will then go down a tier, as it were, if we're looking in the impact assessment hierarchy, and look at environmental impact assessment. And we'll hear from 2 members of the team who formed a joint working group between the European Public Health Association and IAIA. And so we have Odile Mekel, who is the chair, the president of the HIA section in EUPHA, and she works for the North Rhine-Westphalia Centre for Health. And also Ringham Piper, who is a colleague of mine at BCA Insight. Ringham comes from a background of environmental assessment and public health. He also is qualified as a lawyer, so brings a very interesting legal aspect and legal analysis to the conduct of health within assessment. So with that, I will hand over to them, and I look forward to seeing all of your questions, such as you may have, as they come up in the chat box over the next few days. We'll endeavour to answer as quickly as we can. Thank you very much indeed.
Well, hello, everyone. My name is Thomas Fischer. I'm a professor at the University of Liverpool's Environmental Assessment and Management Research Centre. And I have two co-presenters for this presentation, even though they will be quiet today. It's Ringen Piper and Ben Cave from Ben Cave Associates. Ben Cave, of course, at the moment, our president of IAIA. And I'm going to talk about the draft guidance on assessing health impacts in strategic environmental assessment. Now, with regards to the context to the draft guidance, it's a guidance commissioned by the parties to the protocol on SEA, which is part of the Convention on EIA in a transboundary context by the UNECE, the United Nations Economic Commission for Europe. The guidance was developed by, well, the three presenters that I just introduced in collaboration with the UNECE, the World Health Organization, and the European Investment Bank. The latter was also the funder for the guidance. The protocol on SEA itself has currently 33 parties. These are not just EU member states. The EU itself is also a party, but there are also currently 9 countries that are not EU member states, which is important because even though the protocol is part of the Convention on EIA in a transboundary context, the parties signing the protocol say that the protocol is relevant for all SEA activities in the country. Overall, on strategic environmental assessment, just to say that by now it's a formal or a legal requirement in over 50 countries, probably close to 60 now, but is used throughout the world on a voluntary basis, and in particular in the context of development banks and other international associations. What is the purpose of the draft guidance on health? It's to provide, well, the protocol itself, first of all, it aims at providing for a high level of protection of the environment and including health. The protocol, whenever it's mentioning environment, it adds including health, so that's important. And that's through the assessment of plans and programs, so that's similar to the EU SEA directive, but also to the extent appropriate policies and legislation, and this is where it goes beyond directive requirements. What's important is that the way health itself is defined and assessed within SEA is inconsistent across the parties, so across the different countries that are the parties to the SEA protocol. And therefore, the aim of the guidance is to assist the parties, as well as future parties, in efficiently and consistently addressing relevant health impacts in the practical application of SEA. It's important that the guidance aims at supporting proportionate coverage of the wider determinants of health within SEA, based on established principles and good practice. This is the structure of the health guidance. So it has an introduction, then has principles for considering health in SEA. It's focusing on how health is or should be applied in SEA in practice, and it also provides for a few case studies of SEA where health was considered well. one from the Netherlands, one from Estonia, and one from Czechia. Just as a reminder, on SEA itself, strategic environmental assessment is a participatory decision support tool, which aims at making plans and programs, and now that we are talking about the protocol, we need to add, to the extent appropriate, also policies and legislation, more environmentally sustainable, and in this context, including health. SEA also sets a strategic framework for policies, plans, and programs and subsequent development projects, in that it helps to allocate tasks, alternatives to be considered at a particular level of decision making. SEA covers a wide range of issues and is undertaken in a variety of contexts by numerous actors, and it uses a variety of methods, so it's a fairly complex matter. Typically, those that are involved in producing a new plan and program, and then also its associated SEA, will have only generalist knowledge of health, and it's therefore important to involve health specialists that can provide clear, concise, flexible, and strategic health principles to support those SEA practitioners. What are the principles of the draft guidance? To start with, it's important that a comprehensive approach to population health is used, which is usually described by the wider determinants of health. And that's underpinned by the definition of the World Health Organization, which you have here on the screen. So health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The protocol requirement to consult with health authorities is absolutely central to the consideration of health in SEA. Also, the protocol aims at encouraging intersectoral cooperation, as many of the driving forces needed for positive health outcomes come from outside the health sector. That's also important. Right, so when describing how health and explaining how health should be considered as in SEA, it's important that SEA is applied in numerous different ways, and understanding the context is important in order to be able to understand those various ways. And the format of SEA itself, so the procedure, the substantive issues to be considered, the methods and tools used, and then also what roles the assessors themselves play, that format depends on the context. So whether we are dealing with a plan, program, legislation, or policy, what the institutional capacity is to conduct SEA, so the skills, resources, and the time that we have, the requirements as set out in legislation, guidance, and overall objectives, the particular sector it's applied in, can be transport, waste, land use planning, and other sectors. Stakeholders are key. SEA is a participatory process, so the influence of stakeholders needs to be taken into account, and then also the administrative level. The guidance aims at supporting proportionate consideration of health in SEA, so scoping is important, and scoping should determine the relevant, likely, significant effects. It's important to find a balance in this context. So if we scope many things in, many issues in, then the assessment will be highly complex. If we have a very tight scope, focusing on a limited number of issues only, the assessment may fail to adequately address significant impact. So it's really important to get the scope right. And it's important that health authorities should be consulted. And here on the left, you have just sort of an overview of what health aspects we may need or should consider within SEA, so including inequalities, lifestyles, safe and cohesive communities, socioeconomic conditions, environmental conditions, and also health services. Okay. SEA is usually objectives driven, and objectives inform the particular methodology to be used in a particular situation. And just as an explanation, there are usually two types of SEA objectives. One, objectives that are established at international, national, or other levels, and then secondly, objectives of the plan or program itself. It's important that, in particular, the former may only reflect a narrow health perspective, and that certain aspects, for example, considerations that could undermine population health may be overlooked. Desirable practices to articulate and recognize the plan and program's health objectives in terms of improving physical, mental, and social well-being, to consider current and future populations, including vulnerable groups, and also the consideration of the following: health inequalities, lifestyle, safe and cohesive communities. It's those things that I just mentioned in the slide before that were presented on the left-hand side. Alternatives is a very important aspect in strategic environmental assessment, and every strategic environmental assessment should provide an outline for the reasons for selecting the alternatives dealt with and assessed. Criteria are used by many methodologies to rank and choose between different alternatives. And in this context, it's important that an appropriate range of key health issues are considered. When deciding or assessing alternatives and trying to establish the best alternative, we may look at alternatives that narrow health inequalities, promote healthy lifestyles, promote safe and cohesive communities, enhance socioeconomic conditions, enhance environmental conditions, and also improve access to good quality health and social care. It's really important, and well, most of you listening to this are practitioners for impact assessment. So if you consider such a wide range of issues, there will be trade-offs to be considered, and those need to be discussed, and there needs to be a conscious decision on what trade-offs are acceptable or not. When we talk about effects, it's the likely significant effects we are interested in. So SEA should focus on those likely significant effects in terms of environmental, including health. In terms of health effects and the determination of significance, we may use a simple source pathway receptor linkage model, where the anticipated change, the source, the impact pathways, and the receiving population, the receptor, are clear, or a more complex driving force, pressure, state, exposure, effect, action framework. This is explained in the guidance, and it depends very much on the skills, it depends on the time, and the resources on what you will choose to do in the SEA. For health significance, it is good practice to look at the plan and program in terms of, well, the scientific literature and the evidence that we have from the scientific literature, as well as national health priorities. Acceptability of effects or desirability may be informed by regulatory thresholds or national policy for the setting. And importantly, SEA health objectives may be referenced and analyzed and analysis articulated in terms of sensitivity and magnitude. Okay, as I said a few times now, consultation is of key importance, and in the context of health, it's health authorities. SEA does include the requirement to consult health authorities at different stages, including screening, scoping, consultation, and then also, if that's relevant, in relation to transboundary matters. So health authorities should be enabled to express their opinion. And what is really important is that, well, environmental authorities have data on the environment and public health authorities have data on the population in their areas. So if we don't consult them, we are unlikely to hear about those data. It's good practice to establish joint working arrangements between health and other key sectors. And it is acknowledged that appropriate institutional capacity is key to the effective implementation of the protocol. Right. Next steps in a post-COVID-19 world. A few words about where we are with the guidance. It's an official document. On the very first slide, the link was provided to that document. The formal adoption has been deferred at the moment until December 2021, but in the interim, the draft guidance can help the SEA community to, in the consideration of health. Well, at the moment, the world, of course, faces unprecedented challenges in relation to pandemic preparedness and climate change. And this underlines the importance of the consideration of health in SEA and also the importance of the guidance. These challenges and what comes with the challenges are determinants of health to which the intersectoral response should be clarified and led by a robust assessment at the strategic level, in addition to what's already happening at the project level, so at the level of Project EIA. The draft guidance assists parties and future parties to the protocol in efficiently and consistently addressing relevant health impacts in the practical application of SEA. Finally, some headline recommendations, sort of some conclusions. Well, to start with, when you aim at considering health in SEA, use the WHO definition of health. Proportionately scope the wider determinants of health, so not just biophysical, but also social, economic, and institutional issues. Articulate and recognize the plan or program's health objectives. Use health criteria to help distinguish plan or program alternatives in selecting a preferred option, and, well, including being very clear about the trade-offs. Use health evidence sources on importance, desirability, and acceptability to inform professional judgments on the likely significant effects. Establish joint working arrangements between health administrations and other key sector administrations, and address health in SEA capacity issues. That's all for me. Thanks very much.
Hello, today I'm happy to present the work we did together with colleagues, and the presentation today is together with Ring and Piper. My name is Odile Mekel. I work in Germany at a public health institute, governmental public health institute that gives advice to the state government in all issues of public health. And the presentation today is about preparing a reference paper which addresses human health in environmental impact assessment in the context of the EU regulations, the EU directive. We structured the presentation along 4 lines, and first line is why did we prepare this reference paper and why is it important? How do we did it? And then Ring will take over and we'll go more into details about the issues we cover in the paper and about the next steps about it. So first, why is this reference paper important? As you know, health and environment are quite interlinked to each other, and for that, environmental impact assessment, EIA, was developed, and it is a decision support tool that is legally required in the EU for specific larger development projects, and it is an important tool for influencing a range of health determinants at local but also regional level. And quite recently, although recently, 2017, this directive was transposed to in a way that we now have a legal requirement to consider human health in environmental impact assessments, and that across all EU member states. But this directive doesn't specify how to do, which topics should be addressed. And what we see in Europe is that we have not that much guidance documents for considering health in environmental impact assessment. So we see that practice is inconsistent. Therefore, we thought there was a window of opportunity to prepare a paper to encourage good practice by all the people who are involved in this matter to consider health in a good way and to promote intersectoral working with health authorities. On the right side, you will see the WHO statement for a healthy recovery from COVID-19, and over there it also states that the health sector needs to engage in policies that are intersectoral, environmental, health, and economy, and that they need to also approve those so that we all get together better health. So intersectoral working is a key in this area. And what's the challenge? So the practice on environmental impact assessment is informed by the Environmental Impact Assessment Directive. That's in EU system, it's on the EU higher level, but these need to be transposed into national regulation in each member state. So this procedure is very important. And on the left side, you see different guidance documents submitted by published by EU, the European Commission. So we have guidance on screening, we have guidance on scoping, we have guidance on how to write a report, but not yet on how to consider health in these projects. So therefore, we think the reference document needs to be also accessible, and it needs to explain how can health authorities contribute to the process. How can we consider health, human health in environmental impact assessment, but also complying with all these regulations. And that also public health principles and national health impact assessment guidance are met. So these are the challenges we needed to consider in preparing this reference document. How was it written? We established a working group, and you on the right side you see the persons who are involved in this working group, writing group, And we had different several conferences, telephone conferences. So you see on the right side IAIA-EUPHA, and we collaborated with WHO Europe with this. And you see the number of partners we have over here. You see that it reflects the intersectoral work that's needed to consider health and impact assessment. We didn't get funding from outside, so we did it in our own time, but we had some funding from IAIA, $5,000 US, and we are really grateful that WHO hosted the technical meetings. And we had a couple of rounds of consultation. I'll come back to that later on. So most of you are familiar with the IAIA association, and it's a global network on best practice in impact assessment. And IAIA has a section on health, who's organizing also this very nice virtual symposium. I'm president of a section at EUPHA, Health Impact Assessment section, and the European EUPHA is the abbreviation for European Public Health Association. In comparison to IAIA, this is a scientific organization, international and at the EU level, and bringing together multiple associations across Europe and institutes working on public health. And EUPHA is seeking to improve health and well-being, and at the same time narrowing health inequalities across Europe, and facilitating an active and strong voice for all public health networks across Europe, and strengthening also the capacity of those public health professionals. And the section Health Impact Assessment section I'm working with, or the president of, focuses on the promoting of the practical experience and expertise as on HIA as a tool for implementing the principle of health in all policies and for addressing health inequalities, not only in health impact assessment, but also in the formulation of policies, projects, and programs. And as an international scientific organization, we try to transform the health research findings into improved policy and practice. How did we do writing the reference paper? Over here you see the timeline. Initially we had conversations about the initiative to produce a reference paper, and in September 2018, IAIA and EUPHA and the WHO Regional Office for Europe, we formally initiate a joint action. And starting from that, we had in 2019, we organized together in March, WHO at the premises of the WHO Regional Office for Europe, the European Centre of Environmental Health, a technical meeting to discuss a first draft of this paper. Based on these conversations, technical meeting and conversations, we issued a consultation draft and started to set up an online survey so that colleagues could comment and give feedback to us. This consultation draft was also discussed at the European Public Health Conference in Marseille. So that's the yearly conference of EUPHA. And in December, we had a webinar hosted by IAIA, which was really good, attended by over 200 persons from countries around the whole world. In January, the survey closed, the online survey, and we had almost 100 responses. And we took all these comments onto board in January and February, and we issued a final draft in March and gave it to IAIA. And over there was a peer review from the paper. All this information we took again on board, and currently the publication is pending. What can you expect from this reference paper? We made a large effort to keep it concise. So main document is approximately 40 pages, setting out the key components, concepts and the process of health in environmental impact assessment. And as a lot of us need also more hands-on material, this is put into the appendices. Also, again, approximately 40 pages, providing tables and tools for the users. Back again, we started with the technical meeting with a draft paper framed around 6 questions. You see them on the right side. Ringen will go to more detail after my slide. And then we had a large consultation process with a survey asking for critique on each of the sections of the paper. And all these comments were analyzed and took into board, and we issued then the draft paper, which was peer reviewed by 3 anonymous reviewers. And the goal of that was to have more accuracy. And now we are in the phase of the publication. So, which key issues were arising? That will be taken over by Ringen. Off you go, Ringen.
Hello, my name is Ringen Piper. I'm a public health and environmental consultant with BCA Insight, which has a presence in the EU and the UK. I'm a member of IAIA and part of the writing team for this reference document. My background is in EIA, in legal practice, and in public health. So I'm going to be picking up from Odile and going through those key issues that brought about this resource document at that 2019 technical meeting. So on to the first issue. There's a fair bit of detail here, so I will speak to the key points of the slides, but there's some additional detail for you to look through. So the first key issue was around the health sector's participation in the EIA process. And I think the key message is that that participation should be at all stages. This can be challenging because the formal requirement tends to fall late in the EIA process at the consultation stage, which is after the EIA report and the analysis has been largely completed. This isn't ideal from the health sector point of view because it's late in the day to be influencing the project. It's also not ideal for the developer because it increases the risk of new issues arising and therefore that causing challenges to their scope and delay to their time frame. So the message is try and engage earlier. This will often be in an informal manner. It could be at screening, particularly at scoping stage, really important to try and decide on those key determinants of health, which should be the focus of the assessment and the methods by which they're going to be assessed. It can help to formalize that process and to bring those resources to bear to allow that engagement if the health sector is formally recognized as a consultee within EIA. There is scope for this. It's not always taking place. This is because it's a little nuanced within the EIA directive. So EIA directive Article 6, paragraph 1 sets out that each member state should identify the authorities which, due to their health responsibilities, ought to be consultees. Now the EIA directive also defines environment as including health in Article 3, which is really critical. So there is that link between the environmental responsibilities and environment includes health. But that's a hook that's there, and we'd encourage more member states to formally recognise their health sector as consultees to facilitate the process of engagement early in the EIA process. So the relationship between EIA and HIA, this is a slightly complicated and nuanced point. And because of that complexity, which was fed back during the consultation stage of the resource document, that this point is actually not in the resource document anymore. It was considered rather confusing, and we've very much looked to take that consultation feedback into account. But I'll try to give you a quick overview here, but you won't find this in the resource document. So the relationship starts from 2 different points. EIA starts from a statutory position, where it's a formal procedure with a formal output. Health impact assessment has come from a largely non-statutory footing, and it's far more flexible in terms of its process and its outputs. that could be a workshop with recommendations, for example. So the 2017 requirements on EIA have meant that EIA has to undertake an impact assessment of health. So health impact assessment is integrated in some form into EIA. So where that's done well, so that's considering the wider determinants of health and looking at health inequalities, then a separate standalone HIA is generally not going to be needed. However, where EIA still undertake an integrated health impact assessment, but in a very narrow sense, perhaps only looking at biophysical determinants of health like air quality and noise, that can, from a public health perspective, take the view that not all the likely significant health effects of a project are being looked at within the EIA, and there's merit in having a separate standalone HIA. Now, the risk there is that there are some potential compliance problems. The EIA Directive Annex 4, Paragraph 4, requires that all the likely significant effects of the project, including on health, are reported in the EIA report. So if the HIA standalone is reporting additional likely significant health effects, there are some compliance risks, I would suggest, and I think it's for each jurisdiction to take a view on that. But what we would recommend is that health should be considered well within EIA. We shouldn't have this problem arising. This also helps to reduce duplication. It helps to reduce the cost burden on the developer and also the burden on consultees and the decision maker from the number of large documents and whether those are in step or not. So, reporting. We report the likely significant health effects. As we've seen, the developer is required to report those in the EIA report. We've also seen that if engagement comes late and health authorities are only engaged at the consultation stage, then it can be quite important that they articulate any of their views on the likely significant health effects within their consultation responses. And the competent authority, the decision maker about a project, they have to articulate their view on the likely significant health effects within their report and decision in granting an application or refusing it. So when we talk about reporting, we're talking about reporting professional judgments and the reasoned conclusions behind those. Public health has the benefit of a great wealth of scientific literature. It doesn't answer all questions, but where it's available and there's a good strength of evidence, but also a good quality of study, and it's applicable to the context, then that's a really good underpinning of professional judgments. There can be qualitative and quantitative types of judgment, and the reporting of those, the reference document makes reference to 4 principles, and those should run through all the reporting of health in EIA. So that's a comprehensive approach to health, so that's the wider determinants of health considered, equity, proportionality, and consistency. And the resource document goes into further detail on each of those. Where there's a quantitative analysis, and that presents data and algorithms, those should be included. And where it's qualitative analysis, other evidence should be included in the appropriate summary and referenced. EIA looks at residual effects, so that's after you've taken into account mitigation or enhancement measures, and that helps to ensure that the conclusion you're reporting is what you're expecting to happen. It also helps to ensure that if you're relying on any mitigation, that's well secured within either the design of the project or within the legal documents accompanying the application decision. That can be a distinguishing feature from health impact assessment that's standalone as well, which might only be making recommendations. So what counts as evidence when we're making these professional judgments? We've talked about the wider determinants of health, and so it's not a surprise that there are therefore a very wide number of different factors or criteria that might be drawn upon in reaching that professional judgment. And I think practice to date is often a bit of a black box. There's a conclusion. There's not so much on how you got to that conclusion. There's not always that transparency, which can be of benefit to both the decision maker and to the public and to practice in general. So whether it's a qualitative or quantitative approach, which both very valid, and I think worth noting that the quantitative approaches are best undertaken where there's really good epidemiological evidence for the exposure response function, and there's enough of an effect size in a large enough population for this to be a worthwhile use of the project resources. If it's a very small population or a very small effect size, then the number that comes out at the end can have such large error margins that the value of that quantification can be limited. But where a valid quantification can be provided, that can be very useful. It does, however, also need interpretation. So invariably, there's always a qualitative element to the professional judgment and to the reasoned conclusions. And the resource document sets out supporting tools and conceptual models that help to show all the different evidence sources that could inform those different types of conclusion. So it looks at sensitivity and magnitude, which are very common EIA criteria, and from a health perspective, helps break them down. So there's a consistency in how the different factors informing professional judgments on them are shown, and levels within them, what pushes us towards a significance conclusion or not significance conclusion. And similarly, other sources of evidence are also very helpful in a reasoned conclusion. You can look at the scientific data, you can look at the health priorities, you can look at the baseline. They might all point towards what's important in terms of this population health change, and also looking at consultation responses, regulatory standards, and health policy, which might help us to talk about what is acceptable, desirable, or indeed not acceptable in terms of is this effect significance. So that brings us through to what do we mean by a likely significant effect, which is the required output of the EIA assessment. And I think a lack of clarity on this has been a bit of a stumbling block for practice in previous years in some cases. So the guidance sets out some thoughts on what is a likely effect and what is a significant effect. So a likely effect is looking at generally a source pathway receptor model, and it's saying, is there that theoretical plausible link that this could happen? It then says, if that's the case, is it probable that this will happen in the context, or are there a large number of rare and pretty unlikely circumstances that have to coincide for this? So if you can establish that an effect is both plausible and probable, then that ticks the likely criteria. Then going on to significance, this develops the European Commission's definition of significance, which applies across EIA, but from a health perspective, this would mean that the health effects are those that, based on a professional judgment, are important, desirable, or unacceptable in terms of a population health change due to the project in question. And the conceptual model helps to break down what that might mean in terms of either sensitivity and magnitude, or in terms of importance and the evidence sources we've looked at for informing that, and acceptability and the evidence sources we've looked at there. And it helps give some ranges, some prompts as to within these evidence sources, the types of things to be looking at. And that consistency and transparency is really important, not only in building capacity, but also in allowing conclusions to be understood and people to have confidence in those conclusions. So who can conduct these assessments? Who can reach these professional judgments? The EIA directive speaks of competent experts producing the EIA report, and then those reports being examined by people with sufficient expertise. So there are some terms there, they're not defined, and there isn't a formal recognition of what it means to be a competent expert or have sufficient expertise for health, but the resource documents helps to point towards the direction of travel and good practice. So there's a recognition that there's a need for a knowledge of impact assessment, there's a need for a knowledge of public health, and there's a need for a knowledge of environmental sectors. So it's about pulling together skills and knowledge on all three angles to enable you to be talking about health within environmental impact assessment in a competent way. So the frameworks, a conceptual framework, competence frameworks are set out within the resource document. There's the IAIA 2010 impact assessment competence framework, which is really good. And then there's a range of public health competence frameworks that are presented, and those help to triangulate and show how in public health there are a range of hard and soft skills that help contribute towards public health competence. So soft skills like leadership and advocacy, really important for making sure that that scope of health determinants is right and properly considered early on. And also that as you go through the assessment, advocating for good health mitigation or enhancement to get positive outcomes. All this is pointing broadly to the importance of a background in public health for those writing the EIA report, and an understanding of impact assessment for those who are perhaps reviewing the report and already sit within a public health field. And a mix of skills within a team is always going to be valuable. There are so many different sectors bringing forward EIAs that there's a need to be flexible and adaptable. And all that is hard to put into one person. So a team approach is often the best way. So next steps. The resource document aspired to bring a wide range of case studies. This has proved challenging. I think there is a great need to have these case studies identified in the coming years. And so I would encourage people to be looking at not only identifying and documenting good practice, perhaps due to the resource document, of health coverage within EIA, but also that's elusive step for impact assessment of post-evaluation, of actually saying, did we manage to have a positive effect on the population and their health due to how health was considered in EIA? So those would both be really valuable case studies across the EU that it would be great to pull together in a future publication. Capacity building, the resource document really speaks to the need for some capacity building. Tools are provided, conceptual models are provided, everything is there. It just needs the resources and the training to be linked up, and we can really get going with it with excellent practice on coverage of health in EIA. So we've promised a document, publication pending. We are sorting out the technicalities of that at the moment, but there is a pre-publication version available. So if anyone urgently needs burning desire to read it and get into it, do email me, and I'm sure we can get a not for distribution pre-publication version across to you. So some references from what we've discussed today, and finally a thank you for listening, and contact details should you wish to get in contact. Thank you.